Hi, how are you today?
I'm doing good.
That's good to hear. I'm Madison Dillinger. I'm an occupational therapy student, and I'm going to be helping you with treatment today.
Okay.
Could you give me your full name and date of birth, please?
My name is Luba Willis, and I was born on August 16th, 1962.
Okay. And on your chart, it says you have a left distal radius fracture.
Yes,
So your wrist?
I broke my left wrist.
Okay. And how would you rate your pain on a scale from 1 to 10 today?
Today, I would say my pain is at a level of 6. Usually, it's between 7 and 8, but today is not too bad.
Okay. So it's typically a little bit higher than it is today. So
Yes.
it's typically higher on a daily basis. Okay. And do you know if your doctor gave you any precautions with your wrist fracture? Like, is there any rules that he gave you that you have to follow?
No, they didn't give me any precautions. They just kind of told me to be careful with it, don't overexert it. But yeah, no set precautions that they gave me.
Okay. So what we're going to do is we're going to get you started, and I'm going to go through a sensory assessment with you today.
Okay.
Okay, so since you have a distal radius fracture, before I do any kind of modality like paraffin, I want to make sure that you have full sensation in that left hand and wrist, okay?
Okay.
So in order to test that, I'm going to be doing what's called a monofilament test. These are the monofilaments. And so I'm going to test your unaffected hand first so I can have kind of like a baseline of if what you're feeling is correct. Okay?
Okay.
So first, I'm going to have you put your right hand up there since that's your unaffected hand. Do you mind if I touch you?
I do not mind.
Okay. Take this back. So this is kind of, if you can feel that, that's what that's going to feel like. I'm going to start out with this lightest monofilament. They range in sizes as big as this. But I'm not going to have to go up to this if you can feel this lightest one. And I'm going to do this all over your wrist and your hand. Okay?
Okay.
So, like I said, I'm going to have you close your eyes so that whenever I do this, you can't see me physically doing it, and you'll have to rely fully on your sensation. So, whenever you feel me touch you with this monofilament, I want you to either say touch or feel loud enough to where I can know whether you touched it or felt it. Okay?
Okay.
All right, so I'll have you close your eyes.
Touch. Touch. Touch.
Okay.
Touch. 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 Touch.
Okay, you can open your eyes now, Luba. Okay, now that I have kind of like a baseline for what you can feel in that right unaffected hand, I'm going to have you put your left hand up, and we're going to just completely complete this process. Repeat it again, okay?
Okay.
Okay, and you don't mind if I touch you?
Don't mind.
Okay. All right, so I'll have you close your eyes.
Touch. 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 touch, touch, touch. Touch, touch, touch.
Okay, you can open your eyes. So, according to the monofilament assessment, you have full sensation in both of your hands. You were able to say touch at the correct times, and I didn't have to go up to any thicker monofilament than this lightest one. So that tells me that we can use paraffin now. Okay? So that's where we're going to go. Okay, Miss Luva, so what we're going to do today, since we just did your sensory assessment and it appears that you have full sensation in that left wrist and hand, we're going to do what's called paraffin. So a little paraffin bath is made of wax and essential oils. Do you know if you have any allergies to essential oils?
No.
Okay, so what we're going to do is we're going to dunk your whole hand and wrist into this because you're experiencing some pain, joint stiffness, and just overall you don't have great range of motion.
Okay.
So that's what this is going to help with. It's going to help loosen those muscles up, warm them up so that we can use them and create better range of motion, decrease joint stiffness, and that warmth is really going to help with the pain, okay?
Okay.
So before we get started, I'm going to go over a couple of what's called contraindications for this paraffin, and that is pretty much what tells me whether we can or cannot use this, okay?
Okay.
So do you have a fever that you know of?
I do not.
And we checked earlier, and you don't have any excessive swelling or edema, so
No.
that's good. Do you have any blood clots in this area that you know of?
No.
Any vascular diseases, period?
No.
And you do have normal sensation, so this will be good to use in that regard. Have you experienced any unexplained weight loss or gain recently?
No.
And you said earlier that the pain that you are experiencing isn't necessarily constant, but it is at night. You're experiencing extra pain. Okay. So what I'm going to have you do first is go and wash and dry your hands. And then once you do that, we'll even double make sure that your hands are clean, and we'll put some of this cleansing spray on, okay?
Okay.
So while you do that, I'm going to go and check and make sure this paraffin is the right temperature.
Okay. All right.
Okay. Looks like we're good to go. Okay, Miss Luva, let's spray a little bit of this cleansing spray on. Make sure your hands are fully clean. Nice. You can rub that in, yep. Okay, so this is the exact position that I want your hand to stay in that entire time, okay? Fingers spread completely apart, and make sure that when we dunk your hand in here, you don't close your fingers at any point, okay?
Okay.
I want these fingers to stay spread apart the entire time. And these sides are hot right here, okay? So I don't want you to touch the sides, okay? I'm going to try to guide your hand in, so you can step over closer to me. And I'm going to guide your hand in, okay? Don't touch the bottom, okay? We're going to come out 1, 2, 3, 4, 5. Okay, Miss Luva, so now that we went through and we dipped your hand in there and your wrist 10 times, I'm going to have you put your hand in here. Good, okay. Now we're going to wrap it up in this towel. Make sure it insulates it. Okay, and I'm going to have you come sit over here. You can sit in this chair here. And we are going to elevate that hand. Nice. Good. Okay, Luva. So this is a wrist cock-up splint, and best evidence shows that this is what needs to be used for a left distal radius fracture, such as what you have.
Okay.
So today I'm going to show you how we're going to put this on. So what is it that you like to do during the day?
Really, I just like to cook, but that's getting kind of hard.
Cook, and I remember you saying something about a dog. Do you?
Oh yeah, I do have a dog.
Okay, cool. So I'm going to have you wear this at night so that you can still enjoy all those activities during the day.
Okay.
And this is hopefully going to reduce pain and inflammation since we're going to wear this at night so that you can enjoy those things that you like to do during the day.
Okay.
It'll give you hopefully more range of motion in this left wrist and hand.
Okay.
So I'm going to show you how we're going to put this on. Yep. Okay. So I want to make sure that these straps aren't too tight. It's going to put your wrist at about 30 degrees extension, which is proper to relieve some of that edema and still put you in like a functional position.
Okay.
Okay. So the strap's going to go here. So what I'm going to do, and this is what I want you to do at night too, is I'm going to slip a finger through here because I don't want it to be too tight.
Okay.
Okay? But I want it to be tight enough that it keeps you in this position at night. And if you can sleep with your wrist slightly elevated on like a pillow or something beside you, this will really help with that swelling, that edema in your wrist and your hand. Okay, now that we have your wrist cock-up splint on, since you're going to be doing this by yourself at night, I want to make sure that you can do this and you put yourself, like your straps aren't on too tight, okay?
Okay.
So could you take this off for me and then reapply it? Okay. Okay, now I want you to check it. Remember how I did that? Yep. Okay. It looks good. I'm glad that you can do that. So now that you can do this by yourself, and you can always have your husband come and check your straps for you if you wanted to. But I want you to make sure that if you notice any pain, extra like excessive swelling, like irritation of the skin because of these straps, that you notify your clinician immediately, okay?
Okay.
Because we don't want to cause any extra problems with this.
Okay.
Okay. Okay, so there's a couple things that we need to go over to make sure that we keep this brace in as good a condition as we can, okay?
Okay.
So you said you have a dog.
Yes.
So whenever we take this off during the day, I want you to make sure that you keep this up out of reach from that pup that you have, okay? Because we don't want him to get a hold of it and tear it up, think it's one of his toys.
Okay.
Also, if you think that these straps are getting kind of dingy, they do completely come off. And you could wash this with like a warm, soapy water. And then you can air dry those straps.
Okay.
Okay, because you shouldn't be using this in the shower. This is strictly at night. Okay?
Okay.
So, like I said, air dry, warm, soapy water. Maybe use a soap that's like for sensitive skin. So, do you have any questions for me today?
I do not. Thank you so much.
Thank you, Luva.